We try to give these enzymes away from food. Now, if you have a child with a really severe inflamed gut, with gastroesophageal reflux, or with very sensitive GI tract, you don't want to give enzymes on an empty stomach. They can be harsh on the body. Most of our patients can tolerate this fine. So this protocol I'm going to tell you about has some negative side effects to it. It's not all like, this is great, let's everybody use this. It's really for special kids who aren't improving on the other protocol, so those are definitely to be tried first. And also for kids who aren't too sick. Okay, if you've got a really, really sick kid, a really, really immune kid, a really, really inflamed kid, you don't want to be going in and giving them enzymes on an empty stomach. All right? The other part of the protocol is using disodium EDTA. And I know a lot of you say, disodium EDTA, disodium. We're not allowed to use disodium EDTA. We're only allowed to use calcium EDTA. Remember what happened to Tariq? We're not allowed to do that. But this form of EDTA, the disodium EDTA, is not absorbed very well. It's not absorbed. This is for the gut only. So when you take EDTA orally, 10% of it is absorbed. We're not giving it intravenously. We're not giving it as a suppository. We're trying to treat the gut. So it's only given orally. So this is oral disodium EDTA. Again, if you have a very sensitive child, we don't start with oral disodium EDTA. We might start with a little apple cider vinegar or very gentler forms of EDTA, and we use something in our practice called Biofilm. The other part of step 1 in our protocol is lactoferrin, and I talked to you about how that moves iron away from the biofilm, so it helps the biofilm. And then if we have severe strep biofilm that we're dealing with, we use NAG sometimes. Then 15 to 30 minutes later, we start to try to kill the bugs. We start to break down the biofilm first, and then we give something to kill the bugs. Now, it depends on what bugs you're trying to kill. If you're trying to kill Candida, if you're trying to kill Staph, or Pseudomonas, gram-positives, gram-negatives, you might have different choices. The other thing we find is that if you start off with trying to kill with an antibiotic, you might have a really severe die-off. So we don't start with antibiotics first choice. We start with anti-fungal, antibacterial, anti-viral herbs. And we always start low and go slow, because the die-off is going to be the worst in the beginning. So start with low doses. Later on, if we check cultures and we're having persistent Pseudomonas or Staph or Strep maintained, we'll possibly add an antibiotic, or if we're worried about Clostridia. The other thing we see with this protocol is severe die-off. Okay? And so we think, oh yeah, die-off is good, we can handle it. But it can be a lot. And so we have to go slow, and we have to have things to kind of bind up that die-off. So as soon as these bacteria are releasing their toxins, and you're having this die-off reaction, we have something to bind it. So we use a lot of fiber, soluble fiber in the form of citrus pectin. We use bentonite clay or different clays. We use charcoal a lot. And then we have to work on rebuilding, because the body's constantly doing that, breaking down, building, breaking down, building. So we're going to try to do that, break down the biofilm, rebuild the healthy biofilm. It's called a glycocalyx, the healthy biofilm. So, no, not another diet, but I just want to tell you